Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the first Public Health Weekly Update for 2023. This year, in addition to doing regular updates on issues like COVID and climate change, I'm going to do something special. I'm going to address the question of what are the best steps we can take to live as healthy a life as possible. How do we separate fact from fiction of all the ideas and recommendations that people have on how we can live a healthier life? I will also, as I say, I'll do the other updates, but I think hopefully over the course of the year, I'll get 20 to 30 of these evidence-based discussions of things that we can do to be healthier. And this week, I'm going to start with an easy one, which is tobacco smoking and nicotine addiction. Tobacco has been a part of our lives for a long time, especially in our area in the country. You see it growing quite a bit, but it's been around for a long, long time. Tobacco use has been documented for over 8,000 years. It's been cultivated for 5,000 years BC in central Mexico, originally used for religious ceremonies and medicinal purposes. In the late 15th century, Christopher Columbus was given a gift. This is one of the most Eurocentric pictures I've ever seen, and it quickly took off and became very popular in Europe. And then in this century, every effort was made by Hollywood and others to make it appear cool. But the truth is, tobacco smoking is neither cool nor uncool. It is simply an addiction that has very significant health challenges and is impacting people all around the world. And the dangers associated with nicotine and smoking are not new. In fact, in the 1600s, a Chinese philosopher pointed out the dangers of smoking, and Sir Francis Bacon pointed out something addictive about tobacco, though they didn't know what that was. As early as the 1760s, snuff users were warned about the dangers of nose cancer. Just 30 years later, Germans were warning pipe smokers about the possibility of lip cancer. And by the 1930s in the United States, it was becoming clear that there was a link between smoking and lung cancer, which was definitively reported by the Surgeon General in his classic report on smoking in 1964. And it remains today the leading cause of preventable death, disability, and disease in the United States. And today, about 1 in every 8 Americans does smoke. But an interesting aspect of smoking that many people don't think about was reported by Dr. David Kessler in his book, Question of Intent. And that was that most people become addicted to nicotine, become cigarette smokers as children. We need to think about cigarette smoking as a pediatric disease. Fortunately, the number of Americans that smoke has been going down steadily since the 64 report, but it's not going down evenly around the country. And there are some states, and these are the states with over 20%, over 1 in 5 people still addicted to nicotine, still smoking, and other states with less than 13%. And again, so you can see that there are a number of states that are 20 to 25 years behind the rest of the country in terms of tobacco. Now, tobacco is not a United States unique phenomenon. The World Health Organization reports that almost 1/4 of people in the world are smokers. 80% of the world's 1.3 billion tobacco users live in low and middle income countries. The WHO reports that tobacco kills half of its users, more than 8 million people a year, 7 million directly, and about 1.2 million as a result of secondhand smoke. And you can see here that they're not evenly distributed around the world. It's reported that 480,000 Americans, almost 500,000 Americans, die each year as a result of smoking. And the life expectancy for smokers is at least 10 years shorter than for non-smokers. Annually, you can see the number of lung cancer, cardiovascular deaths, and perinatal deaths, including SIDS. It's just an absolute phenomenon how many people die from this public health challenge. And it's not just smokers themselves. The CDC estimates that over 40,000 Americans die each year from secondhand smoke, from both lung cancer and heart disease. Now, I mentioned that this isn't just tobacco smoking, but also nicotine addiction. And there's a new and evolving problem here that we need to be paying attention to, and that's e-cigarettes or vaping or whatever it's called. It heats an aerosol that contains nicotine or sometimes other drugs, flavoring, and chemicals. The users inhale this into their lungs, they exhale it out. And this mist can include nicotine, ultrafine particles, volatile organic compounds, and other chemicals. E-cigarettes are not safe for youth, young adults, pregnant women, or people who don't currently use cigarette products, tobacco products. Now, it's been reported that there is some potential benefits if a e-cigarette helps someone quit regular cigarettes, that can be beneficial, but it's also known that it can harm some people. And the truth is, it haven't been around long enough for us to really know what the health consequences will be. And currently, over half of adults who use e-cigarettes continue to smoke cigarettes. So you get a double whammy, any health risks from the e-cigarette superimposed on smoking. Perhaps the biggest concern, though, with e-cigarettes is how many young people are using them. 3.6 million middle and high school students reported using cigarettes in the past 30 days, including about 1 in 20 middle school students and 1 in 5 high school students. And this is something that has changed dramatically in the past decade. And so what we don't know is where this phenomenon is going to go. But again, as long as we don't really know the risks of e-cigarettes, we're really seeing a huge problem for our youth. While e-cigarettes are probably safer, they are not safe. It has been said that nicotine is safer than tobacco because tobacco includes other products besides nicotine, but e-cigarettes include other products as well. And the truth is, the bottom line is, we won't know the long-term consequences of e-cigarettes for some years, perhaps even for decades. But what we do know is neither smoking nor e-cigarette use is beneficial to human health. So whether it's cigarettes or e-cigarettes, pipes, cigars, quitting smoking is one of the most important steps you can take to improving your health. According to the CDC, this is true no matter how old you are or how long you've smoked. First, if you need help in quitting, please reach out to your healthcare provider or one of the local quit lines, either from the CDC, the Tennessee Department of Health, or anyone else. There are a number of new medications that can help, and the idea is counseling plus medication together can help you quit. So what are the best steps we can take to live as healthy a life as possible? How do we separate fact from fiction? Well, item number 1 is don't start any nicotine product. And if you are currently using one, please see your healthcare provider immediately or call the CDC or the Tennessee Department of Health quit line. Please feel free to share this video or any of the others. All of our previous videos for the last 2.5 years are on the College of Public Health website. If someone has shared this with you and you'd like to be added to the mailing list, please contact Jan Stork at this email address or phone number. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And if you have any questions about any public health topic or any health improvement issue that you'd like to see me address, please let me know. I look forward to hearing from you. Until next week, please be well.